Good morning, welcome to Hot Seat. I'm Scott Mitchell. It's Cerebral Palsy Month. Dr. Amber Stockco with Bethany Children's Center is our guest this morning. Good to see you, Doctor.
Thank you.
Tell us a little bit about Cerebral Palsy Month. You're having a big conference this next week, and it's important because it impacts a lot of families. But let's start with what CP is.
So cerebral palsy means anything in the brain, cerebral, causing anything with the motor system, so palsy. So it can be weakness, it can be tightness, it can be abnormal movements. So any of those would qualify as cerebral palsy if it starts in a child that's below the age of 2 and is non-progressive, meaning that there is no deterioration over time. So any child that starts in the very young age having these symptoms, again, would be considered cerebral palsy.
All right, now this is one of those that the earlier you detect cerebral palsy, the better it is in terms of the therapies and the outcomes, correct?
That is correct. We believe there's a critical window where the brain is very plastic, meaning that they can learn and rewire, and we want to take advantage of that. And if we can do that when they're very, very young with therapies in particular, we feel like we can make a bigger impact on their later function in life.
All right, so the media, although we know about CP for a long time, the media's kind of discovering it. Disney has done a movie about this, and you're having this conference here with national people in to talk about this. One of the things I've learned is that parents with children with CP can be very socially isolated. It's something that really affects the family in a lot of different ways.
Yes, a lot of these kids have varying degrees of being able to be social with others. Some are very normal and they can communicate well. Others do have limitations in communication as well as mobility, and that can be very isolating for some families. And we really want to break that isolation as much as possible with connecting them to other children with cerebral palsy. It's not rare. It's about 3 to 4 per thousand. So there's a good chance that there's another child in their school, but there may not be, depending on the school district.
Do school administrators and teachers, do they have a good understanding of the sort of issues that arise with the child with CP?
It depends. I think there's a stereotype that cerebral palsy is a child in the wheelchair that can't talk, and that's just not true. Cerebral palsy can have a wide range from just mild mobility issues, mild speech, or just one of those factors. Some children are cognitively completely normal or even advanced. I've worked with several doctors who have cerebral palsy and again are brilliant. And then I have other children who unfortunately do have a lot of mental impact and so may not be able to communicate well their needs.
Over the years, and as you're head of neurology out there for children's at Bethany, one of the areas we keep hearing about are advancements in science in terms of prevention and therapies. Where are we at this point in history with the ability to help families function and children function with CP?
We have gotten a lot of new things that we can do. I enjoy taking care of a particular group of children called dystonia, and that is a fluctuating motor tone. And there are things like deep brain stimulation that is now being offered to children with cerebral palsy who have that form of cerebral palsy. Again, there are multiple different forms. There are other surgical options for children who have spasticity, and there's a lot of medication options as well. But again, the most important thing of everything that we talk about is often therapies. And so we really appreciate our occupational therapists, our physical therapists, our speech therapists who help make the most gains.
So families that are experiencing this could come to this event. You've done it for several years now. What have researchers, doctors, what have you folks learned from having families all over the country come in and learn?
We really enjoy this cerebral palsy conference. We feel like it's vital for the families. It connects them to other families. It connects them to resources in the community, whether it's publicly available resources, as well as private groups that may specialize in special needs kids that do all sorts of fun things. Like there's special programs that helps there's special programs that help with things like.
We're going to keep rolling.
Yeah.
Hang on just a second. 3, 2, 1.
So there's all sorts of special programs out there that are some publicly funded, but there's also privately funded. There's like things like dance programs that specialize in kids that may have some mobility issues. There's different athletic programs that adapted sports that allow them to participate. Some very, very competitive sport programs, some less competitive sport sports programs. So there's all sorts of things out in the community that we introduce them to and make sure they're aware of all the resources, as well as community support groups.
Anything else that people that want to support families and these children that are going through this that we need to know?
There's a lot out there already, and we want to highlight those programs, but there's so much more to do. Inclusion is a huge thing. We want these kids to feel a part of their schools, a part of their communities, their sports teams, and we can do that. A lot of these kids are amazing. Their perseverance is awesome, and they're inspiring to work with both the families and these kids. And so that's why I go into it. I love working with this patient population.
All right, this event is next week. What's the date on that?
So it's March 29th, 2025. It starts at 9 a.m. and it's going to be till 1 p.m. There's going to be activities all day long packed in there with all different levels in mind. So we have kids that are early diagnosis, so the younger kids that we're going to be focusing on. We're going to be talking about the older kids, the social wellness aspect of it, the transition to adulthood that they will go through, and so everything in between. So we really have a diverse multiple different breakout sections where they can choose, I'm more interested in this, I'm more interested in that, and go to these various things. Dr. Brandenburg from Mayo will be coming, and she's going to be giving a talk. Her daughter, who happens to have cerebral palsy, will also be giving a talk. She does a podcast about all the things that children with cerebral palsy and adults with cerebral palsy are capable of doing, and she's a really somebody who brings a lot to the table as far as giving us hope for what these individuals can do and are capable of.
All right, that's coming up this week. Here's where you can go to get more information. You need to get registered at bethanychildrens.org/events and learn about this issue that does affect a lot of families, and we'll look forward to seeing you next year.
All right, thank you.
Thank you, Dr. Stockco.